The bulk of the global burden of disease and the major causes of health inequities, which are found in all countries, arise from the conditions in which people are born, grow, live, work, and age. These societal conditions are what we call the social determinants of health. They encompass the social, political, cultural, and environmental determinants of health. Health inequities are, by and large, unfair and avoidable differences in health outcomes between different population groups. They cause unnecessary suffering and result from adverse societal conditions and failing public policies.
In October 2011, more than 1,000 delegates arrived in Rio de Janeiro for a landmark World Health Organization conference hosted by the Brazilian government. Around 125 member states were represented. They'd come to forge a vision to try to give the world's citizens longer and healthier lives. As soon as you arrive at the airport, these scenes of poverty present stark evidence that health is determined by a host of factors that go far beyond healthcare.
Equitable access to high-quality healthcare is absolutely vital when people get sick. But it's not lack of healthcare that causes the problem in the first place. We understand the key drivers of health inequity right through the life course, starting with early child development, education, employment and working conditions, having enough money to live on, healthy and sustainable places to live, and we understand the drivers at the more social and political level. We really understand that. So then what needs to be done is to act on those.
Ladies and gentlemen, as we open this World Conference, much hangs in the balance. Lives hang in the balance. Many millions of them. These are lives cut short much too early because the right policies were not in place. The differences within and between countries in income levels, in opportunities, in health status, and in access to care are greater today than at any time in recent history. A world that is greatly out of balance in matters of health is neither stable nor secure.
Brazil's experience shows clearly how social factors can fundamentally shape health outcomes. For much of the 20th century, Brazil was synonymous with huge disparities in wealth. The legacy of military rule and poor governance over many decades had resulted in massive inequality and wasted human potential. In the last few years, elected governments had worked to improve living conditions and prospects for the poorest in society, demonstrating that the right intervention and policies can bring huge benefits to health outcomes. A medical student during the dictatorship, Paulo Bus, was jailed for speaking out against the regime. Now he chairs the Brazilian Commission on the Social Determinants of Health.
In my country, Brazil, a deep, unequal country, we have a very important, a very interesting policy that is the distribution of better income for poor families.
By improving daily living conditions and reducing inequality, the programme is an example of how intervention can rapidly improve health outcomes. Infant mortality has fallen dramatically and life expectancy has increased, leading to better health across a lifespan. Also, Brazil has monitored the impact of action, meaning policy can evolve based on evidence of what works.
We have 5 years of this program, and the results are incremental. After the first years, the family becomes able to get money for their own conditions. After 2 or 3 years, the family is much more able to get their own money and not more money from the government.
Bem, graças a Deus. Maravilha.
I've been blessed with good health always. I've worked 6 days a week on this stall for 38 years. I'm 74, and for the last 3 years I've paid into an insurance policy. And I can afford that because I still work and now I get a state pension.
There are many commercial interests that are not happy with these policies. But the income distribution implemented by the Brazilian government creates a new medium class. The poor people receive the income, the Brazilian government is re-elected, and the economy goes much better.
Health inequities still exist in Brazil and right across the world. Today, for instance, a child born in Malawi can expect to live for only 47 years, while a child born in Japan could live for up to 83 years. In low-income countries, the average life expectancy is 57, while in high-income countries, it's 80. In the United States, infants born to African American women are up to 3 times more likely to die than infants born to women from other ethnicities. African Americans represent only 12% of the population, but account for almost half of all new HIV infections.
Society has to be fair to its citizens. Even if you are well off, even if you are healthy, the fact that you live in a society that cares about the disadvantaged, this is health in itself. This gives you a feel of well-being.
So how does the World Health Organization plan to end global health inequity within a generation? Action Area 1 is good governance. South Australia has placed health at the centre of decision-making, with health in all policies. Ministers from across government departments have come together with civil society to devise a united strategy to improve health. It's a model that could be applied in any country. Health is a defining factor of good governance. Decision-making must be transparent and policies developed that are clear, effective, accountable and, above all, fair. Government needs to play a central role in tackling a whole range of social inequities like poor housing and infrastructure. Government must ensure that people of all income groups get access to good quality social protection. If their citizens are underemployed, government must offer retraining and lifelong access to learning. New jobs must be good jobs, well paid, stable and stimulating. Action Area 2 is community participation in policy making and implementation. In Southern Africa, the mining, export and financial sectors dominate society and threaten to drown out the voices of the public. It's evidence of the need to engage civil society and actors outside of government in a new culture of participation in health. Equinet, the regional network on equity in health in Southern Africa, has provided a forum where all citizens can participate in discussions about economic justice, social power and the control of resources. This has enabled civil society to confront global processes that threaten people's health and well-being. Community participation works alongside new approaches to governance to help guarantee accountability and equity. Action Area 3, the health sector. If chronic health conditions are detected late, then patients need extensive and expensive hospital treatment for severe complications. When health services are charged at the point of use, they're only available to those with enough money. Health is a fundamental human right, and so to eliminate this inequity, it's essential for accumulated prepayment mechanisms to be introduced and good quality public health services to be provided for all, irrespective of ability to pay. In Brazil, following the end of the dictatorship, urban campaigners and trades unions pushed for the creation of a welfare state, and the Brazilian unified health system was launched in 1988. It's now one of the largest public health systems in the world, providing medical care to a population of more than 190 million. Huge advances have been made, but Brazil, like many other countries, still faces challenges to refocus healthcare provision away from hospitals and into the community.
I work in the market selling garlic 7 days a week. My health problem is that I have tuberculosis. I can't afford to live in good housing. I was treated for tuberculosis, but I didn't realise that I needed to carry on taking the medicines I was given, so I stopped taking them when I felt better. But now I'm feeling worse. I've had to start a new treatment.
The fourth area is global governance and collaboration. Global action must be aligned with national government policies to create equitable, economically productive societies. Collective action is needed from governments around the world to regulate financial markets to prevent economic forces increasing inequity. Working together, they can stop food prices being pushed up by speculators. Cooperation is needed to secure the fair taxation systems that are the bedrock of legitimate government. And global measures are needed to ensure transparency and accountability across governance and financial structures. Multilateral organisations can improve health outcomes by modifying existing policies and practices that have an impact on people's health and well-being. The WHO Framework Convention on Tobacco Control has pioneered new approaches to global action, challenging the entrenched power of the food, tobacco and alcohol industries. Accelerating implementation of the framework is essential.
WHO always has several roles. On the one hand, of course, to advise countries, and there is a convening responsibility of WHO. How does WHO bring together many of the non-health actors to inform them about this approach, to tell them in an advocacy way how they are responsible for contributing towards the social determinants of health.
And the final action area is monitoring. These plans can only succeed if there is an overarching commitment to informed and accountable policy making. All sectors of government and civil society need to assess carefully the true impact of policy and actions to find out what really works. To achieve meaningful progress, it's vital that once they find out, they need to share their knowledge and act on it. Research in Egypt shows how intelligent data analysis can help challenge preconceptions to improve policy making.
We wanted in the data and the measurement to bring this much more closer to the people. So rather than asking the question that we usually used to ask, why the uneducated behave this way, we really ask the question, why is she uneducated? Why didn't she get an education? Why all the uneducated are living in the same area together? So that kind of analysis is really to ring a bell and to make sure that whoever is sort of looking at the measurement, the monitoring, recognize that this is a fairness issue. It's not just a welfare issue.
After days of negotiations, the Rio Political Declaration on the Social Determinants of Health was adopted. Governments around the world pledged to work in all 5 action areas to eliminate avoidable health inequity.
Well, I'm really happy that member states have adopted the Rio Political Declaration on the Social Determinants of Health. It was a great endeavor. It was wonderful to get so many member states here, ministers and heads of UN agencies, and to get them together to really engage and commit to action on the social determinants of health.
I asked the key speakers at the conference in Rio what they saw as the priorities for global health.
The status of women in society, for women to be able and be empowered to take their own decisions, is a key component of lowering maternal mortality. And it has to do with human rights, but it has also to do with the right public policies.
The conversation often is, can we afford to move on health issues? Can we afford, in tough budget times, do we have to put this aside? I think we have to start insisting that we can't afford not to.
Money must go to places and people that they are meant instead of going to banks. So governance is important. Civil society must hold all of us to account. Governments, UN agencies, public-private partnerships, we need your voice. But last but not the least, remember the people.
As the delegates left the conference, a city of tents began to appear in the centre of Rio, one of thousands of similar protests seen around the world at that time. They were a sign of the anger felt globally at the growing levels of economic instability and inequity.
We're trying to establish a reasonable standard of living for everybody in the world with the resources that we have available. That's not revolution, it's common sense.